going back to the sexual, I don't like to use the word dysfunction. I like rather to say that we enhance men and women's sexual experience. And, our laser is able to dramatically improve lubrication in women. It also will tighten the vaginal canal. So, women who've had multiple vaginal deliveries, it helps restore a lot of, more youth, I guess that's what you can say, to the vaginal canal. And then the platelet-rich plasma that we place in the G-spot and the clitoris really do allow a female to achieve an orgasm much quicker. I mean, not being a female, I can only explain what it's like on the male side, but increased orgasmic intensity, duration, frequency. And one of the things people used to ask me when I first started, because I was an oncologist, they were like, what's this new practice like, compared to what you used to do? And I'm like, well, previously I used to save lives, and now I get to hear what my patients describe as I get to change lives, or rather restore lives back to, what it was like when they were, more active and had more energy and were younger. So it's fun, hearing some of the stories from patients. I do, one of the questions I'm always asked is, how long does an O shot or P shot last? And I'd say everybody's, different. For some, it can last, a year, some, a few months. But I remember one of my earlier patients, she and her partner would travel from Atlanta every 3.5 months for their hormone treatment. And she was getting an O shot every time. And at the third O shot, I asked her, I said, and I'm just going to call her Sarah, to come up with it. I said, Sarah, is this not helping? She goes, oh my God, it's unbelievably helping. She goes, it just gets better. Oh, wow. She goes, it gets better every time you do it. So we have people that do it that frequently, but I'd say most people do it about every 6 months to a year. You're not going to hurt yourself for doing it more frequently. And like I said, she just saw better and better and better results every time she did it.
Wow. I mean, I feel like it's maybe more for women, but sometimes it's harder for people to talk about sexuality or sexual wellness. I feel like
it is. It's much more so on the male side.
Oh, really?
Yeah. Men. Now, it's getting better because the older men, it was an affront to their masculinity. The younger guys, the 30 and 40-year-old guys, were raised during a time when there were Viagra commercials on. And so the concept that it's okay for a guy to ask for help became okay. Yeah. The older men, no, I'm fine. When they're not. The younger guys realize, okay, I might need to do something. But again, as these younger men become older men, they're not becoming deficient in Viagra or Cialis, they're becoming deficient in testosterone. But they're now aware that it's okay, or they're not afraid to ask, for help. Yeah. Which has been a big change in the practice compared to when I first started. A man came in only begrudgingly, if I can say the word right. His partner, his wife, was really feeling the love. She had more energy. She had a libido, and he was asleep on the couch. And she was like, you need to get in there. Yeah. Today, the guys are making their own appointments, and they're coming in by themselves. I mean, they know that there's something out there, and they want it. They're not going to be content by dragging and not being able to achieve the ability that they had when they were younger, and so we're seeing more and more younger guys.
Yeah, and I feel like people just don't really know their options. At least I didn't know options with like hormone therapy or anything, or that I would even be a candidate. I didn't even know that.
And when you're putting back in exactly what you used to have, there's not a risk to that. And the stories that we hear from some of our patients as far as their sexual exploits will, almost burn the paint off the wall.
I'm sure you've heard a lot.
You have no idea. I mean, we could write a book on some of this stuff.